Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Nice to have you here. We meet every Saturday at 10:30 a.m. Central Time on YouTube, Facebook, and X, coming to you live at 10:30. We're always available on demand, though, anytime you want, at our website, UroPatient.com. Best place to go to learn more about the show. Also, best place to find all those past episodes. You can watch them all anytime you want. And here's some helpful information. I've got a bunch of handouts available. Just go and visit our website. You'll find the handouts, and there's a handout that you can run off and take home for your own use. Today, we're diving into something that often confuses patients, the Gleason score. It sounds complicated, but I promise we'll break it down simply. So the Gleason score is a grading system used by doctors to evaluate the aggressiveness of prostate cancer based on how the cancer cells look under a microscope. It helps predict how quickly the cancer might grow and spread. All right, so why should you care about your Gleason score? Well, think of it like a danger meter. It tells your doctor how those cancer cells are acting. Low score, they're behaving. High score, they're throwing a party, and not the good kind. This score helps to guide your treatment. Whether we just keep an eye on things, or if it's time to bring out those big guns like surgery or radiation. So yes, it's just a number, but it's one of the most important numbers you'll hear after a diagnosis of prostate cancer. Now let's talk those numbers. When a pathologist looks at your prostate biopsy under the microscope, they're looking at how crazy or calm those cells look. They give a score to the most common pattern they see, and then a second score to the next most common. So if the two most common patterns look like a 3 and a 4, your Gleason score is 3 plus 4, or a total of 7. If it's a 4 and a 5, then it's a 9. The higher the number, the more aggressive the cancer. It's a little like a Yelp review, except instead of rating a restaurant, we're rating how nasty the cancer is. 1-star cancer, not so scary. 5-star cancer, that one's trouble. And you can kind of see from this graph here below. Let me get my pointer here. So these are what they're looking at, how the cells look. And they give 2 grades to each pattern. So here's the breakdown. Try to make it a little simpler. When a biopsy is done, the pathologist looks at your prostate tissue under a microscope, and they give it 2 grades, as we mentioned earlier, from 1 to 5. So you'll never have a grade 0 prostate cancer. The least you could have was a 2. I've never seen that. So grade 1 means the cells look nearly normal. So those are the less aggressive type. Grade 5 means those cells look very different. That means they're more aggressive. They then add these 2 most common grades together to make a Gleason score. So example, a grade 3, the most common, plus a grade 4, the second most common, give us a Gleason score of 7. And you can see from our little balls there, a score of 6, you can be smiling. That's pretty less aggressive, so less than 6. And that's typically the lowest score I typically see on pathology. Score 7, intermediate grade. Going to need something done. Score 8 to 10, that's higher grade cancer. You're going to need a lot done. So yes, order matters. Just like 6 a.m. and 6 p.m. are different, so are 3 plus 4 and 4 plus 3. All right, here's where it gets a little tricky, but I promise you'll get it. Let's say you're told your Gleason score is 7. That could mean 3 plus 4 or 4 plus 3. Both add up to 7, but they're not the same. Why? Because the first number tells us which cell type is more common. If the 3 is your first, your cancer is behaving like a 3 or a less aggressive cancer. But if the 4 comes first, your cancer's acting more like a 4, and that's more serious. Think of it like 2 pizza toppings. One slice is mostly cheese with a little pepperoni, pretty mild. But the other one is mostly pepperoni with a sprinkle of cheese that's a spicy or a slicer. So your total score has a different personality based on which comes first. Keep that one in mind. Okay. So if your brain's spinning from all those numbers, don't worry. Doctors realized patients needed a simpler system. So they came up with something called the grade groups. So instead of juggling 3 plus 4 or 4 plus 3 and a dozen other combinations, they boiled it down into 5 easy to understand groups. Think of it like turning algebra into a number line. So here we go. Grade Group 1. It's the mildest. This is a Gleason 6. And Grade Group 5 is the most aggressive. Gleason 9 or 10. It's like going from level 1 to level 5 in a video game. The higher you go, the more serious the cancer. So when you hear your Grade Group 2, you know you're in the intermediate stage. Manageable, but needs attention. Let's connect the dots. Once you know your Gleason score or grade group, the next question is, now what? If you're in Grade Group 1 or 2, your doctor might suggest just keeping a close eye on things, what we call active surveillance. That means regular checkups, no immediate treatment. Now, if you're in Group 3 or 4, it's time to consider action, surgery, radiation, maybe both. And for Group 5, that's the red zone. We'll likely need a stronger game plan, maybe including something like hormone therapy. But here's the key. Your treatment isn't based on the score alone. Your age, your overall health, and personal preference matters too. You and your doctor will make a plan that fits you, not just the numbers. This is your health. You deserve to understand what's happening. When you sit down with your urologist or oncologist, don't be shy. Bring questions. Don't know what questions to ask? Remember, you can always go to our website at UroPatient.com to the download area and download those questions. Doctors actually appreciate patients who are informed and curious. Start with the basics. What's my Gleason score and my grade group? Then get personal. What does this mean for me? You're not just a number. Your lifestyle, your age, and your goals all play a key role. Now, here's my favorite question. What would you do if I were your brother, your father, or your husband? That one cuts through the medical jargon and gets to the heart of the matter. Oh, and bring a notepad or a loved one to help remember the answers, because, boy, you're going to forget that stuff if you don't. Remember, you're not alone. Understanding your Gleason score is the first step in taking control of your prostate health. If today helped you understand things better, check out UroPatient.com. We've got guides just like this one. And don't forget, subscribe, like, whatever channel you're checking us out on, be sure to follow us. We'll see you all again next week for more at UroPatient.com podcast.
Bye.